I call on Government Orders of the Day, numbers 1 to 8.
Interrupted debate on the third readings of bills divided from the Health Practitioners Replacement of Statutory References to Medical Practitioners Bill.
Julie Ann Genter.
Rise to take a short call on the Health Practitioners Replacement of Statutory References to Medical Practitioners Bill, or the bills that it's been split into. The Green Party has supported this bill from the beginning. We had some questions during the Select Committee process, but all of those were resolved satisfactorily. The main purpose of the bill is changing medical practitioners to health practitioners in a range of legislation so that it provides greater flexibility and potentially and allows us to use our health resources more efficiently, because it enables health practitioners other than medical practitioners, that is medical doctors, to be responsible for a variety of things that they are qualified to do. And I think it's quite practical. It recognizes the skills of people like nurse practitioners and physician's assistants, as well as other types of practitioners who are able to deliver critical health services and who should be recognized as such. I believe the bills have unanimous support within the House. That's not been a particularly controversial change. And as I said, the Select Committee process was robust, and we congratulate the officials who helped us navigate our way through the bills. I guess if there are two concerns that I would have, it's one raised by my colleague, the Honourable Annette King, in this debate, earlier in this debate, which is that this change has been mooted as something that would save vast amounts of money, because it would enable physicians' assistants, nurse practitioners, nurses, and other health practitioners who are not medical doctors to undertake a range of actions and responsibilities. And since generally they are paid less than medical doctors, that therefore would cost the health system less. And that may well be true, and that may be appropriate in some cases. But any additional responsibilities that health practitioners are undertaking should also be reflected in the pay of those health practitioners. So it's not just that we're going to get things cheaper. We actually need to reflect the skills and responsibilities of those health practitioners who will be undertaking additional responsibilities. And that brings me to my second concern, which is our health system is increasingly stretched and under financial pressure. We've had 8 years of a national government that has prioritized tax cuts over investment in the health of our society. And the fact that we've had rapid population growth and we haven't had matching increase to health funding is becoming more and more obvious as people working in the health sector across all areas in the health sector are increasingly overworked and find themselves stretched for resources. And this is particularly true in the area of mental health, where in some parts of New Zealand, the mental health system is stretched to the breaking point. We have severe problems with staff morale because of the ways in which they are overworked. People aren't able to receive the help that they need when they reach out in time, and that's why we haven't made any improvement to the tragic levels of suicide in this country, which have, stayed at the same elevated level because there simply hasn't been the investment in mental health services that they need. Young people are having to wait as long as 8 weeks for a follow-up mental health appointment all around the country. And that's simply too long when people are experiencing significant issues and pressure. So I guess while the Green Party supports this bill, it certainly, while being a practical endeavor to use our resources more efficiently, we also simply need to resource the health system better, and we need to focus more on prevention and the areas in which government can, through outside of the health portfolio, get better health outcomes. by reducing inequality, by alleviating child poverty, by investing in smarter transport, having warmer, drier housing, more affordable housing. There's a whole range of ways in which government can influence the health of the society. And I simply think the national government is failing to do that. They're failing to invest properly in the health system. And our own health minister has admitted to the media in an article to the Listener that the health system is stretched, and it will continue to be stretched as long as we continue to experience this high population growth, because this government has no intention of increasing the amount of funding for medical services and the health system. Instead, they're talking about tax cuts. Well, that is a very short-term approach, and I think it's very indicative overall of the ideology of this national government, which is a very short-term approach to managing the politics day-to-day, trying to give tax cuts where they can, rather than investing in the long-term health of our society, which I think is what most New Zealanders would like to see. Most New Zealanders want to live in a society where we're looking after our environment and we're looking after our people, where we don't have this tragically high suicide rate, where we don't have people struggling to receive the health services that they need. And fundamentally, it will require a paradigm shift and a completely different approach, one that puts people and the environment first before the profits of large corporations and before the interests of the highest income earners and the wealthiest people in this society.
Barbara Stewart.